Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? Ever since the passage of the One Big Beautiful Bill, or H.R. 1, states have been preparing to implement the new work rules that are scheduled to go into effect in 2027, right around the corner. However, 2 new Medicaid work requirement rules from the Trump administration have unexpectedly interrupted those preparations. Each state is responsible for verifying Medicaid recipients and that they're completing their eligibility requirements like work and community service, but those verifications rely on complex computer systems that have a history of cutting off access for families that need and qualify for coverage. As states work to change these systems to fit the new rules and hopefully resolve these errors, President Trump's new Medicaid stipulations are costing states tens of millions of dollars to change their computer software and systems to start from scratch, preparing for the implementation of these new work requirements. The recent additions to Medicaid eligibility rules also make coverage less accessible for recipients with serious medical conditions. Now, it's not enough to prove a condition preventing the recipient from working exists. They must now assess individuals by states to ensure the conditions is severe enough by CMS's new qualification standards. This presents dangerous new barriers to healthcare access that will disproportionately affect our rural hospitals. If you want to read a more detailed report of these new rules, check out the links to our show notes for source information. On to the damage report. Damages from the One Big Beautiful Bill continue to complicate access to care for millions of Americans. More than 1 million American children have lost access to health insurance since the beginning of 2025, mostly due to the increased rates of the Affordable Care Act marketplace coverage, although confusion over changing Medicaid eligibility is also impacting families before the new rules have even taken effect. The current Ebola outbreak in the Democratic Republic of Congo has resulted in 598 confirmed cases and 115 confirmed deaths as of June 8th, and that's according to the CDC. 19 cases and 2 deaths have been confirmed in Uganda as of June 8th. With both patients and healthcare providers battling the illness, rural clinics are struggling to provide the necessary care with limited resources and supplies. The World Health Organization and other global rural health agencies are working to raise funds and send supplies to the communities most affected. But border closures and transport delays have made it difficult to get essential supplies into the right hands. Just like in rural America, our global rural healthcare community needs our support more than ever. And now for today's success story. Seattle Children's recently hosted its first patient prom, giving 35 teenage patients with lengthy or reoccurring hospitalization an experience they may have otherwise missed out on. Volunteers organized the event, which included a dance floor, DJ, dresses and suits, and even corsages for prom goers. Events like this reflect a broader movement from healthcare systems to address non-clinical needs, strengthening the symbiotic relationship between social care and clinical care for chronically ill patients. Thank you to our sources for this episode: KFF Health News, American Medical Association, Becker's Hospital Review, and the CDC.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.